Hello, my name is Beth, and this is my business assessment on the University of Kansas Health System. The University of Kansas Health System is a nationally recognized academic medical center with a strong mission, vision, and values that guide its operations and culture. During this presentation, we will take a comprehensive look at the organization's strengths, challenges, and opportunities for growth. This assessment will highlight and offer recommendations to the executive leadership team to support ongoing sustainability and competitive advantages. The University of Kansas Health System vision is to lead the nation in caring, healing, teaching, and discovering. The health system mission is to enhance the health and wellness of the individuals, families, and communities they serve by providing efficient, value-added, effective, patient-centered care and outcomes that are second to none, working with institutions across the continuum of care to advance optimal outcomes, preparing future healthcare professionals to efficiently and effectively manage care and outcomes, discovering and deploying new approaches that transform the way care is delivered. Their core values that drive their decisions, actions, and care are excellence, compassion, diversity, innovation, integrity, and evidence-based decision-making. Each corner you come around at the University of Kansas Health System, someone is caring for and doing what they can to assist with the healing of the individual that they just met, with no questions asked. This culture is proven each and every day. The Pestel analysis shows an environment that constantly has to change and evolve to meet the needs of its patients and the requirements of its payers. The health system must follow the rules and changes set forth by Medicaid, Medicare, and the Affordable Care Act to be properly reimbursed. Rising healthcare costs and wage competition create financial pressure for the organization that it must know and learn how to navigate. The five forces analysis showed that the competitive rivalry is high due to multiple other health systems available in the vicinity, such as St. Luke's, which was just bought by Barnes-Jewish, HCA Midwest, as well as Advent Health. Supplier and buyer power are both high as well. Supplier power is high due to staffing shortages and competitive wages. Buyer power will continue to remain high due to Medicare, Medicaid, and commercial insurers driving the cost of each procedure or level of care. A threat of a new facility entering the market is fairly low. This is because the amount of capital required and the list of regulations that need to be met are probably out of reach for the small guy and can only be accomplished by an already established health system. The University of Kansas Health System employs the differentiation strategy with a focus on innovation and technology, research integration, such as evidence-based practices, and high quality and safety scores. The health system also employs the focus differentiation strategy by offering specialty services that other hospitals in the area do not, such as specialized cancer care, transplant, and neurology services. The health system also finds itself in the Blue Ocean strategy, expanding its facilities across the state line of Kansas and recently into Missouri. Here we have the 9 components of the business model canvas: key partnerships, key activities, value propositions, key resources, customer relations, customer segments, channels, cost structure, and revenue streams. Key partnerships include the University of Kansas School of Medicine, as well as payers or insurance companies and specialty networks such as the Kansas City Chiefs. Key activities within the health system include research, specialty care, education, and evidence-based practices. Key resources are clinical staff, academic partnerships, technology, and specialized facilities. Value propositions include high-quality specialty care, research-driven practices, and innovation. And customer relationships focus on patient-centered care between the provider and the patient, personalized care coordination for each individual, and partnerships with referring facilities such as Children's Mercy. Customer segments include primary care, cancer, cardiac, and transplant patients, individuals within the community, as well as the recent expansion into rural Kansas. A lot goes into cost structure, salaries, and benefits for both clinical and administrative staff, and facility operations and maintenance, which are both considered mixed costs. Medical equipment being a fixed cost, and pharmaceutical and medical supplies being considered a variable cost. Revenue streams are also very important to the health system and include patient care services, inpatient and outpatient treatments, insurance reimbursement is a big one, as well as grants and donations. The health system uses a multi-divisional structure with 3 towers, Bell Tower, Heart Center, and Cambridge, which each tower is then split into specialty units, and the other departments are organized by specialty as well, such as environmental services, dining, administrative, and pharmacy, among many, many others. This structure model supports both the specialization and academic integration, but it requires careful coordination to continue running smoothly. The health system also maintains a solid corporate ethics framework that focuses on compliance, integrity, and professional conduct, having their own ethics team available for consults and review of certain cases on an as-needed basis to aid in transparency and accountability in both clinical and administrative practices. One of the longest and biggest challenges to the health system is staffing shortages, and this will continue to be a challenge with large numbers of baby boomers retiring. Another challenge is the rising operational costs. Each year or even each quarter, the cost of healthcare rises for both the individual and the health system. Another challenge is the competition continues to increase with neighboring health systems and health systems from other regions wanting to enter our market. Regulatory and reimbursement pressure also continues to be a key challenge in healthcare. Payers continue to control or change how much they want to reimburse for certain procedures, and if they decide to decrease the reimbursement rates, then the health system has to then find a way to make up for that lost income. A few recommendations I have for the University of Kansas health system are to continue improving your staffing ratios. Prior to COVID, the ratios were 3 patients to every 1 nurse. Now those ratios are on average 4 or 5 patients to every 1 nurse, or on a rare occasions up to 6 patients per 1 nurse. This causes the nurses and other staff to get burnt out and want to leave the health system. It is also unsafe ratios depending on the complexity of the patients that they are taking care of. By improving and keeping ideal ratios, it shows that you care for your employees and that you want what's best for them, as well as keeping the patients safe. Offer retention incentives is another recommendation. The only 2 incentives currently offered by the health system is every 5 years of employment, you each employee earns a little bit more PTO each year. And then after 10 years of employment, the health system increases the percentage of which they put into the employee's 401k. Expanding specialty clinics such as neurology, dermatology, and other high-demand specialties would increase revenue and patient satisfaction scores, not having to wait 6, 9, 12 months to get into a specialty provider. Regarding ambulatory services, expanding their hours to either later in the evening or 1 or 2 weekends per month could also increase revenue and give the patients who are unable to take off work the opportunity for an appointment. My last recommendation is to continue investing in innovation and partnerships. Being the first health system to offer a certain type of cancer therapy puts your name on the nation's map, which will draw more patients in, and partnerships also shine light on the health system. The University of Kansas Health System maintains strong strategic identity and competitive advantage. Ethical, cultural, and academic foundations support long-term success. Addressing staffing and capacity challenges will continue to strengthen sustainability. The University of Kansas Health System can and will continue to be the lead in caring, healing, teaching, and discovering. Thank you.